And we'll wait a couple more minutes before we start. All right, we'll get started. Welcome everybody to DO Nights. My name is Carl Russell. I'm the president of the Caduceus Club here at Purdue University, and together with the Purdue Biology Club and the American Medical Student Association of Purdue, we're happy to host wonderful DO schools and talking about their programs. Some quick housekeeping before we start. We'll have a couple of things to do. First off is attendance. Attendance, and then we'll get into some Caduceus Club specific announcements, and then we'll start the DO school presentations. So for attendance, here's a mailing list, but we'll get to that afterwards. But attendance tracking, if you're from Caduceus Club, make sure to fill out the Google form. But if not, I'd like everybody who's a Purdue student to fill out the SEO attendance, and that'd be much appreciated. Great, thanks for that. So the Caduceus Club's vision is to foster productive, informed, morally sound students at Purdue interested in healthcare careers. So if that fits your vision for yourself, make sure to join the Caduceus Club as we hold more of these types of events. Just as a reminder, the participation incentive for this semester is a Caduceus Club hat. Make sure to attend the events and you'll get points. So some initiatives I want to go over before we start. The project fund is still up and running. Make sure to look out for that on the website if you have an idea for a project. Preparatory library is now open. The details are also on our website. And if you want to ever check out a book, whether it's for the MCAT, DAT, GRE, OAT, things like that, feel free to check them out. Some upcoming events. There's always shadowing going on with IURNet. Once the applications are ready to go, I'll send them out. But it's a pretty quick turnaround, so always be on the lookout. Elections are open. Elections are open for nominations until April 18th. Make sure to submit your application for that. The Healthcare Journal Club is going to be this Saturday at 3:30. Fill out the QR code if you're interested in joining the Journal Club. It's a great way to familiarize yourself with scientific literature and to improve your presentation skills talking about research. So the next meeting, it's on the 16th at 3:30. If you're not getting all these QR codes, I'll send them out. Well, they will be sent out at the end of the session. Club GroupMe, if you're not already on the GroupMe, make sure to scan the QR code. Again, the QR codes will be sent out after the meeting. And then also the website's always at the bottom of those emails that we send out to you. So make sure to give it a visit. There's great resources on there. These are $10. If you haven't already paid your dues, make sure to do so. Instructions will be on the slides I'll send out. And Now the main event. All right, DO night. So I'd like to welcome wonderful representatives from these 5 schools. They've all taken time out of their day to present on what makes their school, and to talk about their great programs in osteopathic medicine. We'll go in order: Kansas City to West Virginia, Marian, Pikeville, and Rowan. And yeah, hopefully this is an informative night. You take some stuff away from this, and this will give you some things to think about once you start applying to medical school, and to definitely consider DO on top of your regular MD admissions. They're very comparable schools, and you'll receive a great education there. So make sure to apply to schools if you're interested in them, and I'll give you a chance to get interested in them once we start the presentations. So we'll start out with Kansas City. We have Marcia here. That's all right. Marcia joins. She'll hop back in. But do we have Ryan? I see that you're here. Would you like to start presenting?
Absolutely, I'd be happy to.
Great. I'll stop sharing the screen.
Okay, great. Okay, so I can go ahead and share my screen?
Yep.
Awesome. All right. Okay, so thank you all very much for letting me speak this evening. My name is Ryan Boothe. I work for the West Virginia School of Osteopathic Medicine. We were founded in 1972. So we are celebrating 50 years of educating medical students this year. So we're pretty proud of that. So we'll get right to it. First thing I want to do is just point out a campus map of our campus. So we're really interesting because we're a standalone medical school. So we're not attached to a bigger university or a college. But yet we have a whole campus which looks like a college or university. We have multiple buildings. We have a library, bookstore, cafeteria, student center, a fitness center, on-campus clinic, lecture halls. Our anatomy lab is in its own building within itself. The admissions building, for instance, where I'm in tonight, it's off over to the right in its own building. So we're really interesting. We only have one program currently, which is the medical school, the DO program. So, we're really odd, and we're pretty big. We have a 50-acre campus. And again, so every facility on the property is for you as a medical student. So we find that really appealing. And a lot of students do when they come here. They feel the same way. So here's just an aerial view of campus. And then also just sort of a little drone that we have flying over campus last fall. So we always like to kind of show that. All right, so briefly, I'll talk about our curriculum. Another thing that's kind of unique about us, our curriculum is what's called a patient presentation model. So we teach students, we lecture on all the different body systems. We go one by one, starting with the musculoskeletal system, and then move through blocks into each system. But where we're different is we throw in case presentations, which are common reasons why patients will come see you as a doctor. And we give students these cases, and they have to work through these cases by themselves. They also get to work in groups to kind of figure out what's going on with their patient, so to speak. So we like to put students in that doctor role, that doctor mindset as early as possible. So with each system, the cases will represent that particular body system. So if our focus is musculoskeletal, I can promise you the cases are going to be, joint pain, back issues, things like that. In year 2, we still provide you with cases, only they become more complex and they involve multiple body systems at once. So they're much harder. And then of course, any chance we get, we integrate osteopathic principles into all these lectures, because after all, that's what osteopathic programs are all about. And what I mean by that is osteopathic manipulation, or OMT, or also called OMM, osteopathic manipulative medicine. So this slide just kind of walks you through the different courses that you'll have in your first and your second year. I've also listed some of the other classes that you'll have, which are labs. So in year 1, you have an osteopathic principles lab and clinical skills. I just noticed I don't have anatomy. We also have an anatomy lab spread out through the entire first year. So all of our labs are integrated into our curriculum. So as we move to a new body system, that particular system is what your focus is in all the various labs. You also see under year 1 early clinical encounters. We have an on-campus clinic, so we allow students to go over there and shadow our doctors, and they let them step in occasionally, give shots, do physicals, maybe take histories, minor things. But you're a first-year med student, and some schools won't even really let you necessarily do that. So we're pretty proud to offer some early clinical exposure. Just a few pictures of some of our facilities. We've got we've got 2 lecture halls, one for the first years and one for the second years, because third and fourth years are out doing clinical rotations. So this is just a peek into our year 1 classroom. Each classroom can hold 200 students, because that's how many students we accept each year, is 200. Not the best picture of our lab, but it helps me just describe the lab for you. You'll see in the top left corner, we've got windows bringing in good natural light. It's pretty bright in there, even with the lights out. We've got TVs near every station, so we can play videos, PowerPoints. We have cameras that we can zoom in on something interesting at a particular station and then pop that up on all the screens. So 200 students aren't hovering around one particular table to see something. We can just have everyone stay where they're at and use the cameras to see everything up on the monitors. There's typically about 4 students per table. We have about 50 donors in our lab at one particular at any given time. So with 200 students going in there, we typically have 4 students per table. Sometimes we may have, maybe 45 tables set up, in which case, there might be 4 or 5 tables where maybe 5 students are there. But anywho, those numbers are pretty decent. Students do all the dissecting. So things aren't dissected and prepared for them before they come. So they get a full dissection experience. This is the osteopathic lab. So there are multiple tables in there, and you can see in the left picture, and the bottom picture, you get a partner, a fellow student, and you learn how to do manual hands-on manipulation on your partner. You learn how to do it. They are the patient, then you switch, and the other student gets to take a turn learning these techniques. Predominantly, osteopathic manipulation focuses on the musculoskeletal system. However, there are techniques that students learn how to use on multiple systems. So it does go beyond the musculoskeletal system a little bit. But this is a very hands-on class. Typically, we do this on Wednesdays. All right, so next up, clinical skills building. We call it the Clinical Evaluation Center. This is a 2-part lab for students. The first part involves actors that we're paying to go into an exam room and pretend like they're sick. Students will go in the room. They are being videotaped, recorded, and each encounter is provided to the student to see what they did right or wrong. It's not all about what you know. A lot of this is about just learning how to speak to people, how to communicate properly, how to listen. You also see in the middle picture, you can see like a dummy there. This is one of our patient simulators. They are mannequins that are very high tech and designed to allow students to do a lot of medical procedures that you can do on an actual person. In terms of the exam rooms where our actors are, we have 24 of those in this building. So, there's lots of space for students to take a turn going into the rooms with these encounters. More on the human patient simulators, we have 25 full body simulators. Again, these mannequins are very high tech. A lot of them have things like drug recognition software. Their chest might be able to move to look like they're breathing. Their eyes are blinking. They can react to light. They have chest sounds, heart sounds, lung sounds. You can check their blood pressure and their heart rate. Some of our simulators, you can do a tracheotomy. Most of them you can intubate. So this is really great learning, and you can't really hurt these guys because they're fake. All right, just a couple other facilities that you might be interested in. We have a 24-hour fitness center with a basketball court. We also have a pretty nice student center. It's actually the biggest building on campus. In that building is our cafe, bookstore, study space. We have a big conference room in there. So it's a pretty great place for students to go and hang out. We also have a rec room with pool tables and TVs and couches for students to go hang out. So it's really nice. All right, so briefly about our rotations. So you're on campus and in class during your first and second year. So starting in your third year, you begin clinical rotations. Every school's different how they do this. What we do is we have a statewide campus rotation system. And we broke our state up into 7 regions. And as a student, you get to pick the region that you go to for your third year. So in your third year, you'll do all your rotations sort of in that particular region. And then in your fourth year, however, you're able to leave the state. You can go to other states and do rotations. So we're a very out-of-state friendly school. In fact, more of our students come from other states than from West Virginia. So a lot of students know about opportunities back home in their home state, and they'll go do rotations there. Just briefly, just showing you some of the rotations that you'll do in your third and your fourth year. A lot of these are primary care focused, family med, internal, peds, surgery, those kinds of things. You do have an opportunity to try some things out and do electives. If you have ideas about what you want to do, you definitely have opportunities to do a rotation and try those out. All right, so briefly, a little bit about our application process. We do have some prereqs that we require. These are probably going to be sort of similar to the other schools, maybe a couple variations, but we require 2 English courses or writing intensive are fine. 2 behavioral classes, typically students will do psychology or sociology. 2 biology classes. Typically, we require at least 3 chemistry classes and then biochemistry. So typically students will do Gen Chem 1 and 2, organic 1, probably organic 2, and then we require biochemistry. I think maybe some schools might not require biochem. We do, but that just brings up a good point. Just be sure to know that what the requirements are for all the schools that you apply to. We also require a couple physics classes. And then if you've taken all those classes, you've hopefully had 6 hours of labs. In terms of what makes a student competitive, scoring an average of a 502 on the MCAT, that is our competitive average for this last incoming class. 500 is the national average. So 50th percentile on that test is at 500. So if you are a 500 or better, chances are your MCAT's just fine for our program. Currently, the incoming class, the average is a 3.51 science GPA. So we really don't focus on the overall GPA. We will see the overall, but we don't really make too many decisions based on that. We're focused on the science. And then, of course, it's always a good idea to get clinical exposure and volunteering. Both of those look really good. I'm always asked, what are we looking for there? We don't have any hour requirements, no specific hour requirements. We just ask that you try to really put some effort into it. I tell students try to get at least a work week worth of experience in something. If it's scribing, hopefully at least 40 hours or more would be good. Multiple experiences are good, but for us, it's really quality of the experience versus quantity. And again, volunteering is always nice to see as well. The clinical experiences can be paid or non-paid. We're happy to see both. Just briefly about the application, the other schools might mention this a little bit, but you go to aacom.org. That's the American Association for Colleges of Osteopathic Medicine. And you can apply to just about every osteopathic school on there, including us, which is great. You fill out one primary application, then you can send it off to multiple schools. But typically, schools will have you fill out a secondary application. We're no exception. So be sure to fill out that second application so you get a good, solid review. It's important that you apply early. The application cycle opens up in May. So the closer to May, the better. So you can get looked at sooner and hopefully get an acceptance maybe before you graduate college. At least that's the traditional route, but that's not something that you have to do. We require 2 letters of recommendation. One must be from a physician. It does not have to be a DO, but it's highly preferred that you do have a DO recommendation. Also, we want either a pre-med committee letter or a letter from a science faculty member who had you in their class. We are okay with multiple letters. We're happy to see more, but those are the 2 we absolutely have to have. So if you do get offered an interview, currently we are doing 3 days a week from September to March, about 10 student interviews per day. On Mondays, we do in-person interviews, and then Thursdays and Fridays, we do virtual interviews. Typically, the interviews are about 30 minutes long. Traditional panel interviews, typically there's an admissions person in there like myself, and then we try to get a physician in there. Could be a DO, could be an MD, and then we usually get a PhD basic science faculty in there as well. All of our students who interview get a tour of our campus if they're in person, and then if it's a virtual interview, they will get a virtual tour of our campus as well. And you have lunch with our students either way. So you do get to meet with current students and ask them any questions that you might have. All right, so this is my contact information. If anybody wants to reach out to me by phone or email. Also, the top, there's a link to go fill out an electronic contact card if you want to get in our database. So we can reach out to you to let you know about events going on campus. And it also looks good if we've connected with you in some capacity. We'll see that if you do apply. So hopefully that wasn't too fast. I just didn't want to take up too much time, away from everybody else. So Carl, that's all I have.
Thank you so much, Ryan. And make sure to email Ryan if you have questions about his medical school. We'll move on
Thank you.
To Marian University, Richard Nussle is going to present. Richard,
Yes,
you have the
thank you.
floor. Yeah.
I'll share my screen now. All right, everyone. I apologize if I'm not looking at the camera. My presentation's on a second screen. So my name is Richard Nussle, and I'm the Associate Director of Admissions here at MUCOM, which hopefully being at Purdue, you're familiar with. You've at least heard of us, I hope. So I know we only have about 15-ish minutes or so, so I'm gonna kind of go through about our curriculum, a little bit about next steps, how to apply things like that, similar to the presentation Ryan just gave, but just all about Marian now. Whoops. So for those of you that have never been to our campus, we are actually housed on Marian University's undergraduate campus. With that being said, we do have a building called the Evans Center. And this is the building that all of your lectures, labs, everything is actually done within this building. Okay. But as a DO student, you do still get access to all of the amenities that you would expect on an undergrad campus, right? We have dining halls, multiple eateries. We have a Starbucks on campus, fitness center. You can still get involved with intramurals, things like that. So you can definitely still take part in some of the things that you were probably used to at Purdue at the undergrad level. And then I will just touch on our mission briefly. So we were actually founded in 2010 with our first class starting in 2013. And the reason that we decided to start an osteopathic medical school is that we were trying to address the physician shortage that is expected to occur. And so the mission of MUCOM is that we want our graduates to go on and work in primary care in rural or underserved areas, okay, and populations. Now we'll touch on residency in a little bit, but even though it's our mission, it doesn't mean you're not going to be supported no matter what specialty you want to go into, okay? But just so you know a little bit about our mission and what we're looking for when we're looking at applications and graduates. And then I'm going to go into some of these more specifically in additional slides, but a little bit about why MUCOM, right? You know, so we're the only osteopathic medical school in the state of Indiana. You may or may not be aware, we're one of 2 med schools here in the state, us and IU, SM, School of Medicine. We're the first osteopathic medical school at a Catholic university. So when it comes to being attached to a Catholic university, we get a lot of questions about this. And, you know, I always say that the Catholic background or heritage of the university, there's not really a religious component to the curriculum in the sense that you're not having to go to mass, you're not having to do Bible study. We accept students regardless of religious affiliation or non-religious, right? So that's not going to impact your chances of being admitted. But we're also a Franciscan university. And so we do incorporate the Franciscan values into certain aspects of the curriculum. The Franciscan values are individual of the, or dignity of the individual, stewardship, reconciliation, and peace and justice. So I would say these are things that really all people should be working towards. And we incorporate them a lot with how you interact with patients, ethical scenarios, things like that. Okay. But you're still learning everything you would expect to learn at a medical school, regardless of the fact that we are a Catholic university. Okay. Our curriculum was modeled after the Carnegie Report in 2010. Essentially what that report showed was that students were performing better in 3rd and 4th year if they had gone through a systems-based curriculum. And so because of that, we have a systems-based curriculum, which I'll touch on in the next slide. And then you can see our data for the last class we had our pass rates for. We'll get new updated data this summer for the most recent class too. So that'll always be available on our website. And then a little bit about the curriculum, and I'll actually break it down on the next slide in terms of what the 2 years will look like. But you'll be getting the basic sciences and the application of the material all at the same time. Okay, so I would say if you're someone that's applying what you're learning, we could be a good fit for you. And I'll touch on what that can look like on the next slide. We also have early clinical lectures and engagement. So we do a lot of simulated clinical experiences, just like Ryan mentioned from West Virginia. We also use a lot of standardized patients. So those are those actors we're having come in and present symptoms to you. You'll actually start working with standardized patients in the first 4 to 6 weeks of the program. So how do you get that routine history and physical exam, for instance? We also have 2 student-run free clinics that you can start volunteering at in your very first semester here at MUCOM as well. And then all students are sent out in some sort of early clinical engagement, sometimes through various departments, not always with a physician, right? But you might work with like nursing teams or something like that to get a sense of what healthcare looks like as a whole. So all students are getting early clinical engagement in that way as well. Introduction to Clinical Medicine. This is the course that really uses those standardized patients, and that's the course that's really teaching you all the clinical skills. And I'll touch on that again on the next slide. And then we're also doing interprofessional education with the School of Nursing. So the Layton School of Nursing is also housed in the Michael A. Evans Center here. And so they will do clinical experiences, so simulated clinical experiences with med students and nursing students working together in teams. Okay. So here is what our curriculum looks like. So we are actually transitioning to a 19-week semester starting this upcoming August, so this fall coming up. And so your first semester fall is the only semester that is not systems based. Okay. And so Scientific Foundations of Medicine, we say, is like all your undergrad science courses put into that 19-week semester. Essential clinical anatomy and development. So we also have a full dissection anatomy lab with roughly a 4-to-1 student to donor ratio. Okay. Osteopathic principles in practice you have every semester. So that's again where you're going to learn about osteopathic manipulative medicine. And then introduction to clinical medicine you have in your first 2 years. So like I said, that first semester, it's going to be how to take a proper patient history and physical exam, how do you do proper documentation, right, with your SOAP note, how do you take blood pressure, all of these things, right? And you'll even start, like I said, interacting with our standardized patients. And then second semester is when you get into the systems-based curriculum. Okay, so the first systems you cover are the cardiopulmonary and renal systems, so heart, lungs, kidneys, and then your other courses, OPP and ICM, are also following along with those systems as well. So let's say, for instance, you're learning about the cardiovascular system in lecture. Well, in ICM, right, instead of doing a routine history and physical exam, now when you interact with those standardized patients, it's going to be what are the pertinent questions you ask someone with a history of cardiovascular disease? What are the physical exams that you would use? What labs would you order? What imaging would you order? How do you interpret the results, right, to get to that proper diagnosis and treatment plan? Okay. And so you will basically go through the entire rest of the curriculum in this sort of systems-based approach. So you're still getting more anatomy and physiology and pharmacology and biochem and genetics and all the things you would expect to get. It's all based on the system. You'll also learn how the systems work independently, how they work together, right? Including, different pharmaceutical drugs. I'm sure you've, Paul, well, maybe you don't read the warning labels, but if you look at the warning label of like ibuprofen, right, it says may cause stomach bleeding, right? So even though you're taking a pill for some sort of pain, maybe like a headache, it doesn't mean it's not also working in other systems on the body. So you're also sort of learning how things can impact various systems. Okay, and I won't go through every system. You can see them here. All this information is also available on our website, but this is your first 2 years. We also do case studies and small group works and all of these things outside of your lectures and labs. All lectures are also video recorded, so you can watch them back later, and they're also live streamed. So if you're not on class or on campus, but you still want to watch lecture live, you can watch it via the live stream too. Okay. And then we have third and fourth year. So for our third year, you can see these are the exact rotations you will do. You will not do them in this order, but you will do all of these rotations. You're going to do about 75% of your rotations within 60-mile radius of Marian University here in Indianapolis. So you pretty much know when you come to MUCOM, you're staying local to Indy. If we send you outside of that 75 or out of that 60-mile range, we will have housing provided for you close to the clinical site, okay, for all of your core rotations. And then we have our fourth year, and that's electives, mostly electives and selectives. So that allows you multiple reasons for that. It allows you to set up rotations, hopefully at hospitals you're looking to match to residency. It also allows you to do additional rotations in the specialty of interest for you. It'll also allow you to go out of state if you're interested in going out of state for any of your rotations as well. Okay. So just know this is kind of how your third and fourth year will work. And we do have development days, so you are brought back, especially third year, at the end of every month, where there'll be additional like courses. You'll have some tests that you have to do. And we also have things called just-in-time trainings. So let's say you have your surgical or your OB-GYN rotation for your third rotation. When you come back after your second rotation, part of your development day will be preparing you for that next rotation. So if it's OB-GYN surgery, how do you properly gown on and glove in a sterile environment to get ready for the surgical field, things like that. So you'll also be getting additional training to prepare you for each of these rotations before you go out on them. I'll quickly touch research, mostly to let you know that we do have research opportunities here at MUCOM. We have both bench and clinical research opportunities. We actually have 2 labs on campus, one in the Evans Center, one across campus. We've actually rented space downtown in a biomedical research building, which if anyone's familiar with downtown Indianapolis, it's in the 16 Tech area, so just off of right off the river, real close to downtown. Really nice brand new building over there. And then we also have students that are getting to do research opportunities with some of our clinical partners. I've known students that have done research at Ascension St. Vincent. I know of at least 3 that are doing research at Riley Hospital for Children. And I know a couple others that have gotten to do some at IU School of Medicine as well. So just know that if we maybe don't have a project that you're interested in, we can network with some of our clinical partners at the same time to get you meaningful projects, okay? A little bit about residency. So for the class of 2022, we had a 99% placement rate, 64% matched in primary care. Again, that is our mission. So we see this as a very positive thing. And you can see primary care is family medicine, internal medicine, pediatrics, and OB-GYN. But that obviously means 36% matched in something else. So those students are supported just the same. 71% matched in Indiana and surrounding states. We're a Midwest school with a lot of Midwest applications, right? It makes sense. We have such a large presence here. You can see top specialties there. So outside of primary care, we have anesthesiology, emergency medicine, and OB-GYN as well, or not OB-GYN, that is one of ours. Or one of our primary care. But that gives you an idea of some of the top specialties there and top facilities, most being in the state of Indiana. But then we also had University of Illinois, College of Medicine in Chicago. We also had some sites in Ohio that were our top sites too. So. And I won't cover this too much just because Ryan covered it a little bit in terms of the application process. But just know for us, we do also have rolling admissions, so it is good to apply early in the application process. Again, ACOMAS is going to open up. Normally it's around May 5th. It's normally early May. And then you can start submitting applications on June 15th. We will start receiving those applications. And as we receive them, we'll screen them to see, to send out supplemental apps. You need to have at least a 3.1 cumulative GPA and a 494 on the MCAT to get a supplemental application. I'll touch on averages on another slide. Once you get your supplemental app, you fill it out. There's a $100 fee. Once we get that submitted, we then start screening your application for letters of rec and then doing a full review on your application to determine if you get an interview invite or not. we start interviews in September, and this year we ended in March. And then from your interview, you will go on to a admissions committee decision. I don't know why it says hold there. It should be alternate list, but you can be admitted, not offered a seat, or you can be put on the alternate list. Okay, that's kind of how the whole rundown goes. And since we're rolling admissions, we're just constantly giving out interview invites and giving out seats. Okay, so that's why it's good to apply early. There's a lot more spaces available in June and July, right? Than there are if you apply in February. So our deadline is February 1st for your primary. Okay. So for instance, we had a deadline of February 1, supplemental deadline of March 1, but we stopped interviewing on March 25th. So everyone that submitted on March 1 with their supplemental, it comes way more competitive to get those last seats. So we do review every app for the last seats to see who we want to bring in, but it's more competitive when we have 10 spaces open instead of when we have 550 open. Okay. I threw this in here real quick. I know Ryan was touching on prereq, so I figured I'd throw it in here too. But you can see where your pretty standard medical school letter or prerequisite courses. If you have questions, feel free to reach out. My email was on that first slide. But they're pretty standard, I think, for most of us. So. Letters of rec, we require 3 letters of recommendation, run from a science faculty member. We consider sciences, biology, chemistries, and physics departments. If it's outside of that, it's an individual basis that we can admit them or accept them. We require a pre-med or pre-health letter or committee letter. If you don't have that, you need a second science faculty letter. We will also count a research letter towards one of those if you do research. And then we require a physician letter. It has to be a DO or an MD. We will not accept any other letter for that physician letter. Okay. And this is good to know because we get people that apply every year that don't have our letter requirements. And if you don't have our letter requirements, you will not move on past the supplemental application invite. Okay. So keep that in mind when you're applying because it's not cheap and I'd hate for you to waste your money. Here's the class of 2025 profile. You can see number of applications versus candidates interviewed, average GPA 3.65, average science 3.57, average MCAT is a 5.04. Okay, just to give you an idea of how competitive you might be there. Excuse me. I'll touch on this briefly. We do have a biomedical sciences master's program. So if anyone is looking to maybe improve their academic metrics or how competitive they are for medical school or another health professions school, we've had people interested in PA school, pharmacy school, things like that. But no, it's a master's program, 1 year or 2 year track, 2 year tracks research focused. But if you're coming through and you get a 3.5 in our fall semester and you have a 497 or higher on the MCAT, you are guaranteed an interview to MUCOM in the spring. Okay. And if anyone has questions about any of these things, just reach out or you can ask when we open up for the question session. So kind of a quick one sort of quick last slide is, I think no matter what school you go to, right, you're going to get a good quality education. So what are the things that I think help us stand out or things that might be important to you, and, we're a small school, so you're really going to get to know your faculty really well. We have open door policy, so you can go up and talk to your faculty at any point in time. I was actually talking to a student a couple of weeks ago that said that they at one point had gone to ask their faculty member a question, and he actually came down to the study room and drew things out on the whiteboard for them. We are really foster collaboration and working with each other, right? Study groups. I know students send study guides out to each other. You get a lot of mentorship. You're going to get a upper class mentor, a faculty mentor, and then we also have an optional program called the Meaningful Mentorship in Medicine program. And so that's an optional third mentor you can get with someone in the actual community outside of MUCOM. We really care about student wellness. So we have wellness activities. So we have Asia Hudson, who's our director of student wellness and organizations, who puts on wellness activities weekly, like every Thursday's Therapy Dog Thursdays. We have a student organization called the Wellness League that puts on events. We also have free mental health counseling on our campus as well for students that need that, or just look for someone to talk to. You don't need to be in a crisis to utilize those services. And we also have a lot of student organizations, over 35 different student organizations, depending on what you're interested in, right? So you can still definitely get involved here at MUCOM as well. Okay. So with that, I don't know if the Q&A session might be at the end. So with that, that's all I have for this opening presentation, Carl.
Thank you so much, Richard. We'll move on to the next presenter, Michael Kennedy from the University of Pikeville. Michael, you have the floor.
Well, thanks for having me, folks. Thank you for the invitation, Carl. I'll tell you, I've been traveling all day and my flight just landed. So I'm casually dressed, not because I don't respect the process, but because I've been on the plane all day. So it's nice to meet you. I'm going to touch on some of the things of similarity. I'd like to compliment Richard and Ryan. They did a good job of covering the basics on things. So I'll just reiterate that and give you some fill in there. So KICOM is located in Eastern Kentucky. We are the only DO in Kentucky. And when you look at our school, I travel all over the country and people ask me what makes our school unique. Well, we only have a student population of roughly 2,000 students with undergrad and graduate students. But when you look at our school, we're one of the few campuses. We have an osteopathic medical school and an optometry school on our campus. So approximately half of our students are either medical school students or optometry students. So the campus dynamic is very different. We still have all the normal amenities that you would find in an undergraduate institution, whether it be, fitness center, intramurals, et cetera. But again, very different dynamic. What are some other things that make KICOM different? Our biomedical sciences professors are on what are called teaching contracts as opposed to research contracts, although many do research. And what that means is they're specifically hired in the biomedical sciences areas to be there and be available for our students. So that means that if they're not in the classroom, if they're not in an associated lab, they're in their office and available to meet with students. And, one of the nice things that Zoom has brought on is, as opposed to having to make an appointment or whatever, you can sometimes just bang out a quick Zoom meeting with a professor and get an explanation on something as opposed to waiting for a meeting. So our professors are very available. KICOM was founded in 1997, so we're celebrating our 25th anniversary. We got a little ways to go to get to 50, but we're looking forward to that. Our class size is 140, and each year we get about 4,000 to 4,500 applications there. What makes you competitive? Everybody's kind of touched on averages and MCAT, and they're all, what I've seen tonight anyway, are relatively comparable. Our science GPA last year was a 3.56 and the MCAT was a 5.03. But one thing I like to talk with students about is sometimes averages can be a bit intimidating. You look at an average and you go, well, I'm not a 3.65 or I'm not a 3.56. Maybe that's not the place for me. Well, I believe Richard mentioned their minimum of 3.1. We look at least a 3.2 science and cumulative GPA, along with at least a 4.98 or better on the MCAT. So maybe you've done really well academically in the classroom and just not maybe done quite as well on your MCAT. We're going to look at that holistically, look at your academic trend, how many hours that you've taken, science hours in conjunction in a semester to see, are you ready to take that kind of academic load? The course load here normally runs between 21, 22 hours. We do block scheduling and block testing. So you do 4-week blocks in a semester, fall and spring. At the end of that 4 weeks, you're going to take a block exam. It's generally a 200 question test, randomized. Just again, it's geared toward helping you prepare to take your board exams. So by the time you will have finished your second year, you will 16 of those. So you've got a pretty good endurance, and we're going to be helping you prepare for your boards. Now, one thing that makes ChiCom unique also, because our school was initially founded in an area that was incredibly medically underserved, many of our first students were first generation college students and certainly first generation medical students, and generally didn't have a whole lot of economic means to pay for school, much less all the additional equipment and so forth that would go along with that. So we actually have a grant that's not part of your tuition that you pay. It's called the ChiCom Advantage. With that, we pay for your iPad Pro. We pay for all of your electronic textbooks. We give you your white coat, your scrubs. We give you an OMM table along with all of your diagnostic equipment. So that's something really nice because you're not having to shell out, many, many thousands of dollars on top of your tuition. You receive all of that during your first week during orientation. So oftentimes people conceptualize ChiCom as a very regional institution. They think, well, only people from Kentucky or Appalachia come here. And in any given year, we normally have students from 25 to 30 other states. So if you're in a different area, don't be discouraged. Although we might give preference in terms of interviews to local students, we certainly don't give priority in terms of admitting them over someone else. So as the other two presenters talked about, the cycle opens early, so apply early. Our letters are very similar. We can take a committee letter, but we also need a DO or MD letter, one or the other. If you don't have a committee letter, we will take three faculty letters and your DO MD letter. At least two of the three need to be science faculty. So again, similar in nature. Our prerequisites are very parallel to what was discussed earlier, so I'm not going to list them up there. Sometimes students will think that they cannot apply if they're in progress with coursework. I think it's important to know that just because you're taking physics 2, you don't need to have completed that prior to applying. One thing I would strongly encourage you to do is, this summer will make 25 years ago that I started working in higher ed. I do that because I like students, and it's really important to establish a relationship with the schools that you're interested in, because you really have 3 tiers of applications. You have the top tier, which is basically about the top 10% or so. You have 65 or 70% that look very similar, and then the other 15 or so percent that are more on the bottom. Well, that middle tier, that 65 to 70% of applications look very similar, and establishing relationships where you're more than just a name on a spreadsheet as someone's reviewing your application can help you stand out. So I'd really encourage you to do that. If there's one takeaway that I would take away from tonight, is really make sure and do that, because it will help set you aside from other students. So I encourage you to do that. So in terms of the first 2 years, we also heavily utilize OMM. We're an OMM heavy school. You're normally going to have about 300 hours of OMM training. We have a clinic on campus that is run by our attending physicians, also our third-year fellows, but you're going to be working in that clinic the very first semester of your first year here, getting exposure, working with standardized patients, working with your fellow classmates in terms of doing diagnostic procedures, and then also diagnostic techniques. We do have a traditional gross anatomy lab. We're the only school in Kentucky that does head to toe dissection, not prosection. And our table ratios are very similar to what you've heard earlier, 4, occasionally 5 students per table. Again, class size of 140. So it's big enough where you're not kind of feeling like you're overexposed, but small enough where you feel very much family. And people ask me all the time if you had to choose one word, and I'm not very good at just one word, but how I would describe ChiCom in terms of the environment. It's a family environment. Professors are very supportive. They do have an open door policy. It's very common for our students to be passing resources to one another from year to year because they want to help lift their fellow students up and have them do well. Going back to the ChiCom Advantage for a moment, one of the things that come along with the ChiCom Advantage is we also provide free test prep for our students for your step one. We provide UWorld and some other resources, and we pay for that for you along with paying for your first step one exam. So again, we're trying to provide the resources to make sure that the students are successful. As Richard indicated, we also place a heavy emphasis on mental health as well as physical health. We just recently opened a new gym, but we also have 2 licensed clinical social workers on campus that work very closely with our osteopathic medicine and our optometry medical program. I think both deans in our schools do a great job of destigmatizing that and really significantly encouraging students to take advantage of that. We also have built-in academic support systems through our student affairs division, so that if you drop down below a 70% on even one of your areas of exams, then we're working with you. They're providing tutoring, study sessions, et cetera, to help bring that score back up to you, for you, I should say. We don't want to leave you out there floundering and then see you all of a sudden washing out of school. So we provide the resources there to make sure you're successful. Rotations. So after you go through your first and second year, we're going to get into rotations. Our rotation sites are intentionally in smaller rural areas. The advantage to that with our students is, as opposed to maybe a large regional teaching hospital where you're standing, 5, 6, 7 rows deep trying to see what's going on, you're oftentimes going to be working elbow to elbow with a physician, whether it be closing up after surgery or helping deliver babies, et cetera, which is a pretty neat experience for our students. And that's one of the many things that contribute to, over the past 5 years, we've had either a 99 or 100% placement rate. And we're certainly proud of that. One of the things that's a growing concern is, what if I invest all this money in my medical education and then I can't get a residency? So, we pride ourselves on that. And our Dr. Crum, who is one of our graduates, is our associate dean for clinical affairs and establishes those relationships and does a good job of facilitating. So those are the things that really are going to benefit you from coming to ChiCom. In terms of how the academic process works, ACOMAS, we've already talked about that. Apply early. We are rolling admissions, just like mentioned by the other 2 gentlemen. Again, I would encourage you to make sure that you get to know your administrators, because that helps set you aside. It's okay to reach out to me and say, hey, I turned in my application a while back. I did receive an application complete letter, but can you give me a status update? Oftentimes that's going to draw my attention to what might be that 70% and have me take a closer look at you. If you don't fall in the range that we've talked about, let's say maybe you have a 3.1 science GPA, but I look at your academic trend and you've done really well in the last, year and a half, or maybe you've taken a master's program and you still can't quite get it up to a 3.2, but you've done really well in those courses and your academic work is reflected in your MCAT subsets. We're still going to kind of go out on that limb and make sure that you're included and looked at for an interview, because even though we say the 3.2, there are certain mitigating circumstances where maybe someone started out in a hole. One thing I've seen in 25 years is we're oftentimes not the same students later in our academic career as earlier, hopefully in a good way. And, you're working to climb out of a hole. So if you're a 3.1, but you've got a 5.05, a 5.07, and your subsets look strong in those areas, we're going to give you a good hard look. So if you're looking for a family environment that's student-centric, that's going to help provide the resources for you to be successful, that's what ChiCom is. How we're going to do it, the last 2 years, we've had to do all virtual interviews, but we offered campus tours on the weekend to admitted students that were led by current med school students. We're going to continue a hybrid model of that. We also offer online Q&A sessions, and we developed those to take the place of the interaction that you would have gotten the last 2 years if we would have been doing on-campus interviews, talking with current students. So it's a different way to be able to communicate with current students. So what I'm going to do is I'm going to put my name here in the chat when we're through, and how to contact me. And one of the things I would tell you is if you have a question, whether it's about our medical school or any other, reach out to me and let me know, and I'll help you any way that I appreciate Carl having me tonight. Enjoyed talking with you all and look forward to answering any questions that you have in a bit.
Thank you so much, Michael. I really appreciate your presentation. So we'll move on to Kansas City University. Marcia is here to speak about the school.
Hi, everyone. Welcome. I am from Kansas City University. My name is Marcia. I do have a presentation that I'm going to share, but feel free if you have questions, go ahead and put it in the chat, or even after the presentation, feel free to ask questions too. And then I'll leave my name and information so you can ask as well after, and you can just email me. So let me go ahead and share my screen. Awesome. Okay, hopefully everyone can see the presentation slide and nothing else. So just let me know if you can't. Okay, so like I said, I'm from Kansas City University. I am one of our admissions recruiters. So I am behind the scenes, helping students with applications, interview process, all that exciting stuff. So I'm going to talk about today the College of Osteopathic Medicine. That's a big majority of what KCU is. We do have other programs. We have our Master's in Biomedical Science. We have our PsyD program, so our Doctorate of Psychology. And we actually have a new dental program starting up in 2023. So if you have questions about those ones too, feel free to ask. I'm happy to talk about them. But I am going to mainly focus on our COM program, our College of Osteopathic Medicine. Okay, so we have two campus locations. I don't know if anyone's familiar with Kansas City, Missouri. There is a Kansas City, Kansas as well, but we're on the Missouri side. So we have two campuses that make up Kansas City University. We have Kansas City downtown, which has 270 seats. They have multiple buildings across campus. It gives a little bit more of a campus feel, what you're used to. And it falls right downtown where, right in the heart of it, which is exciting. There's a lot of things to do around Kansas City. Then we have another half of our campus is in Joplin. There's 162 seats available in Joplin. Those two campuses make up the 432 seats we have in the DO program every single year. Joplin is a little bit more suburban, rural. There is one large building that makes up Joplin with tons of classroom and study space all throughout, but it's a little bit smaller, not much walking you have to do around campus, which some students really enjoy. So I'm going to talk a little bit about our application timeline, what it looks like every single year. So our primary application through OCOMIS application becomes available May 1st. So we're actually coming up soon, very soon, on a new application cycle. The best months we say to apply are June, July, August, just because once that May 1st deadline's open, you can get all that material set in, have your application submitted in June, July, or August, and then it leaves space for, getting into the cycle early, possibly getting an earlier interview spot, and kind of knowing where you want to go and what your acceptance looks like at the end of the year around Christmas time. We don't have any specific or hard deadlines. We are rolling admissions, so we are taking applications throughout the cycle, but a suggested deadline we give is September 15th. Just like I said, so you get that earlier interview spot and you have, you understand what you're going to do and where you're accepted at by the time Christmas rolls around. If you qualify for our secondary application after you submit your initial one, those are going to come out between July and December. And then we conduct our interviews from September through March. Right now, our interviews are virtual, or they have been virtual. Going forward, we might stick with the virtual setting, at least for now. Obviously, we won't start doing interviews again until September of this year. So there's a lot that could happen between now and then. So we may move back to in person, but the virtual setting has made it very flexible for students, and we still make it a really fun day. So that's a to be determined, but that's how we have done the setup this past year. Okay, so these are just some of the requirements or things that we look for on your application. We talk a lot more about the competitive profile instead of requirements, because we look at an application from a holistic perspective. So we like to look at everything you bring to the table. We don't always like to advertise our huge requirements because of the way we look at applications. But this is just a lot, what we see, what we like, and what students send in that gets them far in the application process. So a minimum of a 500 MCAT score. The MCAT scores have to be not old. I don't know. They can't be from 2 years prior to your application. So this is actually going to change. So it's going to be May of 2020 for our new upcoming applicants. A minimum of a 3.25 science and cumulative GPA. We're looking at both. We're weighing everything out, seeing what you have. A bachelor's degree from a regionally accredited university. You'll have that checked off. And we'd love to see experience in the healthcare field. So we'd love to see shadowing experience. We'd love to see that you're volunteering. We love to see that you're getting out there, having jobs in some kind of medical background. I've had the big question, especially over the past couple of years I have virtual hours. What can I do? How is that going to reflect on my application? We will accept virtual hours if it's virtual scribing or virtual shadowing, anything along those lines. We would love to see and would like to see coming up that you have in-person hours as well, especially because the world thankfully is opening up a little bit. But we understand if in your experience or on your resume, you do have some virtual shadowing, we'll accept that as well. We're big on volunteering. That's kind of what our campus is done. Our mission is built on. So we love to see that you have a volunteering background, mission work, volunteering, even a community service club at your university, just something that shows that you have a passion for volunteering. Just because that's something you're going to do straight in orientation weekend, you're going to get involved in some community service and volunteering activities. We like to see that as well. Other requirements: 2 letters of recommendation, one from a pre-med advisor or a committee. We can substitute a science faculty member if need be for that specific letter. We also require one from a physician, a DO or MD. That's somebody you've shadowed or someone you have a relationship with, just someone who can really speak to your background and why they think you'd be a great doctor. And you can submit other letters. You don't just have to stick to 2. If you would like to send other letters on your behalf, you can. Letters must be dated within 2 years of your matriculation year. So if you are applying for this upcoming cycle starting in 2022 for the starting class of 2023, then your letters can't be no older than 2021. Okay. Like I said earlier, this is kind of what we show students a lot when we talk in person is our competitive profile, not as much our requirements. These are the students that we see come through our program. They get admitted, they're successful. We see these scores. So it's a 507 MCAT score, a 3.65 science GPA. Cumulative usually falls around a 3.65 to a 3.5, and a lot of shadowing experience, 1,000 hours of whether it's work, volunteer, shadowing, etc., all those combined. Like I said, we're really big on a lot of those things. So we like to see that you're really out there in the community, doing what you like, and it's reflecting. Okay, I'm going to talk a little bit about the curriculum. So years 1 and 2, modified systems based. We cover systems of the body in both year 1 and 2. How it works is you can actually learn all of year 1, and then starting in year 2, you'll almost learn year 1 again in like a quick review, just to help with those building blocks. A lot of students really like that way because it's a good refresher, especially after coming back from a little bit of a break. You'll also get a clinical experience right out of the gate first semester of your first year. You'll do different patient care assessment practice. We have actors come to campus to pretend to be in some kind of distress, and you work with them on your patient care skills right out of the gate. We do provide specialty tracks for students if they have a specific route they want to go down. We have our global medicine program and our military medicine program. The students really enjoy. I believe the global medicine is a newer program as well. So a lot of students have found interest in that recently. Then we also have dual degrees. So you could have an MBA in healthcare leadership, a master's in bioethics, or a master's in public health. Okay, and moving into years 3 and 4, it's the rotations. So a distributed model. We have sites all over the country. So it really kind of reflects on where the students want to go. We don't hold students back. If they want to go out, they want to leave Kansas City, they can, or leave Joplin, they can. It's a weighted lottery, so 99% of our students got their top choice. We actually just had our match day 4 weeks ago. It was really exciting. I'm originally from the East Coast, so it was exciting to see a lot of students go to even my hometown, because I never thought about it before. So it was cool to see all of that and see where students got to fall. I know one student went to Hawaii, so that was cool too. 50% of students do stay local if they want to. They're feel grounded in Kansas City and Joplin. This is where their home has become. But we don't, obviously, like I said, we don't make students stay here. So if they want to go out and experience, go into different communities or go to a different state, they can. Okay, these are just some of our resources that we provide for the students. So full-time clinical psychologists, learning specialists, academic advisors that are available on hand for you if you ever have questions or need anything. We have our Big Brother Big Sister program, which actually is getting a name change. So you're the first to know. We are going to change the name of this specific title, but I believe it's going to be called like more of a mentorship, but that's pretty much how it works. So you're paired up with an upperclassman, I believe orientation weekend, actually, right off the start. And you just create that relationship with them. They're kind of helping you through what they've already done. I like this aspect of it because I think learning from someone who's been through it already, been through the classes, know what they're like, can really give you a great sense of, how to prepare. We love to know how to prepare, especially me. Knowing what's coming next. So having that mentor, I think, such a great aspect to a resource that they add. Tutoring resources, so you can have tutoring if you need it. And we also do board test prep. I believe they focus really heavily on it your second semester of your second year, but you can always take it if you want to take it a little earlier. Okay, this is just some of our track record. This is, where students fall. We have 100% residency placement, and we have students fall, in all different categories. So like I said earlier, you can really create your own. You can do what you want. You can go where you want. It's your career. So make it as you wish. We have a big percentage that goes into primary care. It kind of is, like I said, just a student's preference. I've, in my own life experience, actually have met a Kansas City DO in an emergency room. Everybody was okay in the situation, but it was fun to see a DO out working the field and doing what they love to do from KCU. Okay, I'm going to talk a little bit about the College of Biosciences. We do have a linkage program to our DO school, so that's why I touch on it just a little bit. But this is our College of Biosciences. This program is only on the Kansas City campus. So something the students, if they want to come to KCU and they want to do the master's program first, then you already get acclimated to the KC campus, the downtown campus. So, you already kind of get the feel for where the area is and what you were looking for. The program is either 1 year or 2 years. The second year, if you do the 2 year, that second year is going to be more of a research heavy track. The application is a post-BACAS. Your application is available in early October and it closes June 1st. Like I talked about earlier, we do have rolling admission, but for this, we do close it due to the, when classes start. So you want to keep those dates in mind. The KCU COM linkage program is what a lot of students become interested in because it is a placement. If you score a 3.5 GPA or higher your first semester of the master's program, you automatically get a interview for the DO program. So you don't get admitted 100%, but you get a interview, which surpasses a lot of other students who have to do the initial application, do the secondary application. So you get a little bit of a leg up and you're already learning the KCU curriculum. You're already kind of understanding how you're learning, interacting with professors. So it can give you a leg up if you want to go into the College of Osteopathic Medicine program. Like I said, you have to finish the first semester with a 3.5 and you have to score a 500 MCAT and submit that whenever you're going through your application process. This is our competitive profile for the BIOS program, a 495 MCAT score, 150 on each section for the GRE 4.0 writing score, a 17 DAT. So if you want to submit other test scores, you can do that as well. You don't have to just do the MCAT or the GRE. I will say if you want to do the COM linkage program, submit the MCAT. Don't do the GRE, just submit the MCAT, especially because that's what we'll look for if you want to get an interview for the DO program. And we'll want to have a competitive 3.0 science and cumulative GPA. Okay, so this is my information. I'm going to put my direct email in the chat as well. But this is our KC phone number and our admissions email. Like I said, if you have any other questions, we're coming up on a new cycle. So we're really excited to get applications out there and find out, where everybody falls. If you want to let me know if you're applying this upcoming year, definitely do that. I'd be excited to learn. But yeah, that's all I have for you presentation wise. I'm going to stop sharing my screen. Does anyone have any questions they have right off the top of their head? Anything they want to put in the chat? I'll put my email in too.
Hi, Marcia. We'll have one more presentation and I'll kind of open it up to like a little Q&A if anybody has any questions for all of you.
Okay, awesome.
Yeah, thank you so much.
Yeah, thanks.
So last but certainly not least, we have Nigel representing Rowan University. Nigel, if you want to hop on, share your screen, I'll make you a co-host and the floor is yours.
Sure. Thank you, Carl, so much for arranging this. Good evening, everyone. Let me go ahead really quick and share my screen here. Okay, again, thank you so much for having me. My name is Nigel James. I'm the Assistant Director of Recruitment and Outreach at Rowan University School of Osteopathic Medicine. I'm going to go through quite a bit of slides. However, I'm also holding back on a number of them as well, just so that, in the interest of time, we're able to get through as many slides as we can. So I always like to start out by just stating the mission of Rowan SRM, which is to develop clinically skillful, compassionate, and culturally competent physicians from diverse backgrounds. This is something that our admissions committee uses diligently in the admissions process, or staff or administration. This is at the center of any action that we take, any proposal that we make, any changes that we do to the curriculum. We always keep this mission in mind. It helps guide our direction. So Rowan S1 was founded in 1976. We were one of 7 health schools of health sciences in New Jersey. It was the University of Medicine and Dentistry of New Jersey. And back in 2012, there was a restructuring act that sort of broke us apart, but integrated us with Rowan University, which is in the south of New Jersey. We're the only DO school in the state, and we're about 20 minutes outside of Philadelphia, 2 hours from New York City, an hour from the Jersey Shore, to give you an idea of exactly where we are. We just opened up a second campus location in Sewell, New Jersey, which is about 20 minutes from this current campus in Stratford. So I'm not going to spend too much time, of course, on the principles of osteopathic medicine. I'm sure a lot of other institutions prior to me did go over a lot of this, but of course, as a student who may be applying to DO schools, you certainly should know the philosophy and the principles of osteopathic medicine. There are a number of ways of getting to know more about osteopathic medicine, such as events like this, but of course, each state has their own osteopathic association. You can of course, reach out to ACOM, AOA, or shadow an osteopathic physician. So again, there are a lot of opportunities to really learn more about osteopathic medicine. So Rowan SOM does have a commitment to diversity, equity, and inclusion. This is something that is at the forefront, again, in our mission. And our committee is definitely interested, of course, in creating a diverse applicant pool to help meet the needs of New Jersey and the nation. We have over 3,000 graduates, 50% of whom practice in the state of New Jersey. We have a competitive match rate. We had 100% in 2020, 99% in 2021, and 99% in 2022. We're a leader in research and research funding. Or Rowan University itself is the 4th fastest growing public research institution. And as part of the medical school, the osteopathic medical school, we actually account for about 40% of all the funding that even comes into the university. We offer a number of dual degree programs for students who might be interested. I know med school is long enough as it is, so not a lot of students actually, go into the PhD DO program or even the JD program. But again, it's there for students who might be interested. We also have a DO MPH and DO MBA. We have 2 curriculum tracks for students to choose from, as everyone learns differently. And to ensure that students are learning at their best, we have a problem-based learning curriculum and a synergistic guided learning, which is a fancy title for really more of your traditional lecture-based curriculum. And again, as I mentioned, we have an additional campus opening in 2022, this July, here in New Jersey, which will bring us to a total of 288 students in our incoming class, making us the largest medical school in the state of New Jersey. Again, this is just showing the previous 5 years of our match rate, which shows a really competitive match rate year after year, and students match into a number of different specialties and competitive specialties as well. As I mentioned, our institution does do quite a bit of research. Our faculty is involved in research. We have a number of centers of excellence, as we like to call them, that is tied to the school. We have the CARES Institute, which works with children who are abused, the New Jersey Institute for Successful Aging, that looks to improve the health of the elderly population, the Risen Center, which works with patients and their families with physical, intellectual, and developmental disabilities. And students are able to not only shadow within these centers of excellence, but potentially conduct research as well. I will put this link in the chat for anyone who may want to know, how do I get involved in research while I'm in medical school? I have a recorded webinar by our DO PhD student who really explained it well, and I can certainly share that in the chat. As I mentioned, we have 2 different tracks that lead into the clerkship years. Problem-based learning, which would be more of your case-based curriculum track that has small group sessions, and your synergistic guided learning, which is your traditional lecture-based curriculum. It does incorporate some small group sessions as well. They both merge into the clerkship years. All of our clerkships are done in the state of New Jersey. I think as of last year, we did have 1 additional site in the state of Delaware. Our additional campus in Sewell, New Jersey will bring in an additional 72 students in the problem-based learning curriculum. And again, that's starting this July, so in a couple of months. It will have pretty much a lot of the same resources and settings as the campus in Stratford, New Jersey. But of course, it's still one school, two different campuses, and students are free to move around from different campuses and utilize any campus as they please. The ability for students to be able to attend medical school on the same campus as a clinical practice, or even in our additional campus where the first floor is a clinical practice, is that it really creates this dynamic synergy of learning where students are welcome to go onto the first floor and partake in the practices, shadow physicians, network, and really be part of a patient practice. Third and fourth year students can also complete rotations at any one of these clinical practices on our site, on our campus. So in regards to getting in, of course, and being seen as a competitive applicant, our admissions committee really stress that the science GPA be strong. They typically recommend about a 3.5 and above in the science GPA. For students needing to strengthen their science GPA, we typically recommend a graduate program in the sciences. For the MCAT, our committee recommends about a 500 and above to be considered competitive. Of course, the higher the better. In particular, our committee does pay special attention to that bio section, where they like to see about a 126 and above on that bio section. Of course, holistic review is more than just the grades and the metrics. The admissions committee is also looking for, the road traveled, your journey to medical school, your community service, leadership roles, employment, just different things like that. So be ready to tell your story and share everything about your journey to medical school. We require 2 science letters or a committee letter, and we don't require a letter from an osteopathic physician, but it is recommended. For the application process, it does start in May. So anyone interested in this application cycle, the cycle opens up in May. Students can start submitting as early as June, and we'll send out secondary applications in July. We also have an early decision program for any student who might consider Rowan SOM to be one of their top choices of medical school. The requirements for that is a 3.60 cumulative GPA, a 503 minimum MCAT score, and must submit their primary application by August 15th and complete their entire application by August 31st. We have an opportunity for students to shadow students currently. Shadow either the SGL track, the PBL track, and the email for that is rowanSOMshadowing@gmail.com. This is all student run. Our student ambassadors handle everything from communication to scheduling and setting up everything. But it is a nice opportunity to get to shadow and understand more about PBL or SGL. I also offer one-on-one consultation with students, so anyone who might be in the application cycle or thinking about applying eventually can certainly schedule a one-on-one where they're able to upload copies of your transcripts, MCAT scores, CVs, and bring your questions and concerns, and we just have a 30-minute one-on-one about your particular journey to medical school. So thank you so much. Again, I know it's a lot of information that I ran through and probably a lot that I skipped over, but in the essence of time, I wanted to leave a little bit of opportunity for questions and Q&A session.
Yeah, thanks, Nigel. Yeah, I also want to open up to everybody. And that's all the schools that are going to speak today. So does anybody have any questions for the representatives of these medical schools? If not, I recorded the session. I know it's the end of the semester. Students' schedules are crazy. Exams are coming up. And yeah, I'm sure what I'll do personally, make sure to share the contact information of all of you to the organizations of AMSA, Caduceus, and the biology club. And if they have any questions, I'll make sure to have them reach out to you all. But yeah, I appreciate all of you representatives coming out. I appreciate the members that come out. Yeah, you made it a great session, and I hope to hear from all of you in the future. Any questions for me before we sign off?
Thanks for
set it up, Carl.
Yeah, thanks so much.
Of course, yeah. Thank you for coming. You guys have a great rest of your evening. I'll stop the recording now.
Thanks, you too. Hey, good luck the rest of the semester too.
Thank you.
Bye.